Hi, everybody. My name is Diana Avenue, and this is another edition of the Mount Clemens Minute. And today we have a very special guest with us. We have Karen Wood with the MyCare Health Centers right here in downtown Mount Clemens. How are you today, Karen?
I'm great, Diana. Thank you so much for having us here today.
Good. You know, I really wanted to make sure that everybody in Mount Clemens understands some of the resources that we have. And MyCare Health Centers is really a gem that I believe is very underutilized in our city. So tell us a little bit about what types of resources you're able to bring to our community.
Yeah, Diana, that's a really great point because I truly believe that MyCare is one of healthcare's best kept secrets. People don't know we're here. And health centers, federally qualified health centers, exist to serve the underserved and meet the needs of the community. So we're right here in downtown Mount Clemens in the Clemens Center right off of Gratiot, and we provide medical, dental, behavioral health, transportation services, and if people need help with insurance enrollment, we do that as well. So we've been here for 10 years in Mount Clemens, and sadly, I don't know that a lot of the residents know that.
So being a resident of Mount Clemens since 2015, you know, I drive by it all the time, and I often wondered, well, what is this? So it's very hard to make sure that we all understand what's happening if we don't really know what's going on in our own communities. So for somebody like me who is blessed enough to have health insurance, it's not something that I would notice. But there are a lot of people in our community that struggle with poverty and don't have the same resources, and that's who really where we're trying to focus on. So how do we get the word out in our own community about what's available? Tell us about some of the programs.
Oh, that's a really great point. So MyCare has the ability to provide care to everyone, whether they're insured or not.
Okay.
So we take all of the commercial insurances like Blue Cross, HAP, Aetna, all of those, but we also take every type of Medicaid. And then for folks that don't have any insurance or are underinsured, like if you have very high deductibles and copays that you cannot afford, we offer a sliding fee scale.
Oh, wow.
Yeah,
Okay.
so it's great. So we don't turn people away, and we don't care if you can pay at the time of your visit or not. We work with everyone to get them care and then worry about whether or not they can pay on the back end. So we have people that will sit down with patients and help them enroll in insurance if they're eligible for Medicaid, because these enrollments are confusing. Some people don't know how even to fill out the application. So we have trained people that can sit down with them, walk them through the process, and then if folks don't qualify for insurance, MyCare will pick up the tab through our sliding fee program.
So tell me a little bit more about that. So how is this program subsidized?
Great question. So we receive federal funding, and it's through, there's community health centers or federally qualified health centers all throughout the country, and we meet very, very strict guidelines for compliance to be able to qualify for federal funds. So the majority of our funding comes from billing insurance companies, but we also get some funding from the federal government to provide services to folks that if we weren't here would go without care. Yeah.
I love it.
Yeah.
So I know that not only in our community here, but in most communities in general, behavioral health or mental health is severely understaffed, and there are a lot of people that go without because they don't have the resource. Give me an example of somebody that you can help with your behavioral health services.
Oh, yeah, that's a really good question. So we have trained therapists, licensed masters, social workers, and we provide behavioral health services to people that we find through our medical centers that may have behavioral health needs. You know, through the routine appointment and screening, we determine that there may be a behavioral health need, such as depression, anxiety, or even bipolar disorder. So we will have our doctors refer them to our therapists, but we also take people right off the street. So someone that thinks they might have some depression can call us, and we'll get them in to see one of our therapists. And they're amazing. They're just amazing. And, you know, the success stories, the stories of people that have been, you know, just struggling with depression and then I'll give you an example. They might see one of our doctors, and our doctors determine that they are depressed. And then, so many times, they might just be able to refer them to the therapist for treatment, and they'll be able to live normal lives. But some people need medication therapy as well. So what's really cool about MyCare is everything happens under one roof. So we're able to provide care and coordination of care between professionals that all work together. So the doctor can say, hey, Mrs. Jones, I saw her on Tuesday. She's having some depression. I started her on this medication, but I want to get her in for an evaluation. And then the therapist and the physician work together to treat that patient. And you just don't get that anywhere else.
You don't. That's pretty amazing. So something that you said, people right off the street. Here in Mount Clemens, we do have a fairly large homeless population.
Yeah.
And a lot of people that find themselves in that position are in that position because they have behavioral health issues that they don't think that they can be helped with. Is there any kind of outreach that you're doing for that specific demographic?
Yeah, so we provide transportation services. So if anyone doesn't have transportation, like perhaps a homeless person, we're happy to bring them into our clinics. We do some outreach with McRest. Okay. And then we partner with our sister FQHC located in New Haven in Macomb County that has actually a homeless program. So many times, we find someone that's homeless, and if we provide the services that we can, but if they need homeless case management services or health care for where they're at, we partner with other entities in the community as well. So yeah, the homeless, it's cold. They need help. They need resources, and our FQHCs are uniquely positioned to connect people with resources in the community. So
that's amazing. There's also, I believe, a very underserved population of our community here in Mount Clemens. We have some of the highest poverty numbers in a very large quadrant of our city. Is there any type of outreach that you're doing or that you plan to do to make sure that the word gets out that everybody can get medical, dental, and behavioral health care through the MyCare Health Center?
Yeah, so we have done many outreach events, and we continue to do so. We're governed by a board of directors that's truly amazing. Most of them live and work in our community, so they provide us with guidance. And one of the things that we do every 3 years is a strategic plan. And our strategic plan gives us the direction that we need from our community to where we can target our efforts. So we are using our strategic plan to address the needs of the community and outreach with other organizations or to certain populations. We're using our data analytics platform to look at poverty levels by zip code so that we can make sure that we're outreaching to those communities. So, and if anyone is listening to this podcast and thinks that MyCare can help them, I would love to talk to them, because this is why we exist. This is why we're here. We want to help the community. We want to help people lead healthier lives.
Yeah. So let's talk about the elephant in the room, right? The big C word. We've had a pandemic in our community since 2020. Are there any resources that the community here can obtain from MyCare Health Centers?
Oh my gosh, yes. I'm so glad you asked. This is a really great question. So one of the things that we implemented very quickly due to the need is telehealth services. So with the pandemic, people were afraid to go out. They wanted to stay in their homes and stay safe. So we implemented a telehealth platform where people can see all of our services right through the comfort of their own home, using their phone, using their computer, and we can provide medical and behavioral health visits right through telehealth. So that's wonderful. So that's been a game changer and really helped a lot of people.
Yeah.
The other thing that we were able to do is we opened up a testing center when COVID hit, and we were able to test people right off the street. It was a drive-up testing center, and we tested thousands of people in our community just so people knew if they had COVID or not.
Right.
Since the incidence of COVID has gone down, we have moved our testing back into our clinics. So we have testing out of our Mount Clemens clinic and our Centerline clinic now. And then we started doing vaccinations as that became available. Yeah, so we're doing thousands of COVID vaccinations. So certainly if anyone needs a vaccine, they can just call us and we'll take care of them. The most recent thing, well, actually there's two things that we've done recently. Because we provide services to the underserved, the government recognizes that MyCare is able to take care of folks that may go out without care if we don't connect with them. So we were able to get home test kits that we are giving out, home COVID test kits that we are giving out in our clinics. So we're giving them to our patients, our staff, anyone that walks in off the street. If you need a COVID test, walk into one of our clinics and we'll get them for you and your family.
That's wonderful.
Yeah, and the other really, really amazing thing that we've been able to get our hands on is life-saving antiviral medication.
Oh, wow.
Yeah,
Okay.
and really hard to get, but because we treat people that are very, very high risk and underserved, we get the medication through the federal government.
Wonderful.
So when we identify someone in our clinics that has COVID that's high risk, we're able to treat them with these antivirals to help the disease not be as severe. So that's something that we definitely wanted to get out to the community as well, that if you do test positive and you do feel that you're high risk, give us a call and we can get you treated.
That's very cool. Now, I know we're getting probably short on time, but I do have one other question I want to ask. Do you have any programs that promote health and wellness from the standpoint of, I'm not sick needing care, but how can I stay healthy enough to not need care?
Oh, that's another good question. Very, very good. So preventative care is key. So MyCare provides routine testing, recommends routine doctor's visits so that people don't get sick, so that people stay healthy and lead healthy lives. So we're a quality award winner. We're really pleased. We won an award last summer from the Michigan Quality Improvement Network because of our quality metrics, because our patients are getting healthy, because our patients aren't getting sick because they're changing their lifestyles and trying to lead healthy lives. So
Very cool. So Karen, how can somebody reach out to MyCare Health Center?
Oh, great question. So we're on the web like everybody else, mycarehealthcenter.org. Our clinic in Mount Clemens, let me see if I can remember the number. I think it's 586-783-2222.
Wonderful.
So, just give us a buzz. We would love to have you as a patient. We'll try and get you in and get your needs met.
Great. Well, thank you for being with us today. I think this is information that is very vital to our community, and this is time well spent. Thank you very much for joining us.
Thank you, Diane. I appreciate it.